Welcome to this concise overview of abnormal psychology. In the next 5 minutes, we'll explore what makes certain thoughts, feelings, and behaviors abnormal, and why understanding this field is crucial. This video is for anyone curious about the human mind, especially those who want to understand mental health challenges better. We'll demystify complex concepts, providing a clear foundation for what abnormal psychology entails, its history, and its real-world impact. First, let's tackle the fundamental question. What does abnormal truly mean in a psychological context? It's not always straightforward. Abnormality isn't a simple binary. It exists on a spectrum, influenced by cultural norms, personal distress, functional impairment, and statistical rarity. What's considered abnormal in one context might be perfectly acceptable in another. To fully grasp abnormal psychology today, we must look at how societies have viewed and treated mental illness throughout history. These perspectives have drastically changed over time. Early theories often attributed mental illness to supernatural forces like demonic possession, leading to harsh and ineffective treatments like trephination, drilling holes in the skull, or exorcism. The Enlightenment brought a shift towards more humane approaches. The rise of modern psychiatry saw figures like Philippe Pinel advocating for moral treatment in asylums, replacing chains with compassion and observation. Today, our understanding of abnormal psychology is guided by various conceptual models that help us categorize, explain, and treat psychological disorders. One of the most comprehensive is the biopsychosocial model. This model posits that psychological disorders arise from a complex interplay of biological, psychological, and social factors. Diagnosis plays a critical role. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, is the standard classification system used by mental health professionals to diagnose mental disorders based on specific criteria. Now let's briefly touch upon some of the most commonly encountered psychological disorders within this framework. Anxiety disorders, like generalized anxiety disorder or panic disorder, are characterized by excessive fear and worry that interfere with daily life. Symptoms can include persistent worry, racing heart, and shortness of breath. Mood disorders, such as depression and bipolar disorder, involve significant disturbances in a person's emotional state. Depression is marked by persistent sadness, while bipolar disorder involves extreme mood swings. Schizophrenia and other psychotic disorders involve a loss of contact with reality, often manifesting as hallucinations, delusions, and disorganized thinking. These are severe conditions requiring comprehensive care. Personality disorders involve deeply ingrained, inflexible patterns of thinking, feeling, and behaving that deviate significantly from cultural expectations and cause distress or impairment in social functioning. Fortunately, significant progress has been made in developing effective treatments for psychological disorders, often involving a combination of approaches. Psychotherapy, or talk therapy, includes various techniques like cognitive behavioral therapy, CBT, which helps identify and change negative thought patterns, and psychodynamic therapy, which explores unconscious conflicts. Pharmacological treatments involve medication prescribed by a psychiatrist to manage symptoms, working to rebalance brain chemistry. These are often used in conjunction with therapy. Integrated care, combining psychotherapy and medication, is often the most effective approach, tailored to the individual's specific needs and diagnosis. Holistic support is key. Understanding abnormal psychology isn't just an academic exercise. It has profound real-world implications. A key reason is reducing stigma. By learning about mental health challenges, we can challenge misconceptions, promote empathy, and encourage open dialogue about mental illness, fostering a more inclusive society. Promoting mental health awareness helps individuals recognize symptoms in themselves and others, encouraging early intervention and access to vital support services. It's about building a healthier, more compassionate community.